Hi guys, my name's Amy. I will be talking to you about pertussis today, about whooping cough. And what I'm going to be focusing on is the etiology of pertussis, and I'll touch on the reservoirs of it as well. Hopefully I'll give you a good introduction to this disease. Let's get going. So first off, there are three main bacterium that cause pertussis or whooping cough. The first one is Bordetella pertussis. This causes the vast majority of pertussis cases, the vast majority of diagnoses. There are two other bacterium, Bordetella parapertussis occasionally causes this, and Bordetella bronchoseptica is rarely the causative bacteria. So those three have to be shown present to confirm a diagnosis of whooping cough. But often the clinical symptoms of whooping cough are really distinctive, and it can be diagnosed without this. But if you do need a for sure diagnosis, you can take a culture, and usually this culture is taken from the nasopharyngeal area to confirm the presence of one of those three bacterium. And I can say from experience, I've actually done this. I'm a nurse and I've actually collected this specimen before, and it's just straight that area directly behind the nose, and you actually go through the nose to collect it. And I can say it's not fun for anybody involved, the gatherer or the patient. But that's how you can get a for sure diagnosis of whooping cough, is with the presence of Bordetella pertussis, Bordetella parapertussis, or bronchoseptica. Bordetella. But for our purposes today, we will be focusing on Bordetella pertussis. And I just wanted to hit on a couple of the big characteristics of this disease, or of this bacterium. And they're actually all things that we've been studying, so it's kind of cool that we really know about these things. So first big thing about it, it's a gram-negative bacterium. So it's going to stay pink or red after gram staining. It's not going to turn that purple. Pertussis, like many bacterium that are gram-negative, is more resistant to treatment because of this characteristic. Another big thing, its general shape. It's usually cocobacillus shape, so just a plump little rod, but not quite spherical. Bordetella pertussis is an aerobic bacterium. It survives best when there is oxygen in the environment. And actually, just with the aerobic, Bordetella pertussis usually, where it starts, where the bacterium stays and like starts growing, is in your respiratory tract, in like the cilia and that lining. And so it's obviously a very aerobic environment, and so that's why it thrives so well there. It's also a capsulated bacterium, and this capsule, so not only is it gram-negative, but it's also encapsulated, and this just adds an extra defense against our immune system, and this definitely ups the pathogenicity of Bordetella pertussis. Makes it a little bit harder to treat. This is definitely not something that just goes away, that your body can fight off. Usually requires treatment, especially in children. So just a little review: gram-negative, cocobacillus shape. It's an aerobic bacteria. It's capsulated. It's non-motile, and you can see at this bottom picture down here, it's usually arranged singly or in small groups when a culture is taken, just like that. And that's a pretty good picture with all the staining of what Bordetella pertussis will look like in a culture stain. Keep going. But what really is causing the symptoms of Bordetella pertussis is the pertussis toxin, and that's what this bacterium produces. It's usually produced in an inactive state, and then the toxin is by the bacterium once it starts growing and multiplying in your your respiratory tract. And this toxin, it disrupts the communication between the surrounding cells. And it's thought, there's a little, not for sure, but it's thought that this toxin is really what's causing that distinctive cough of whooping cough. And this toxin also slows down the initial infection response of your immune system. And last, this is pretty quick, there's only one known natural reservoir of this bacterium, and it's humans. And so lucky us. But that is the basics of the etiology of Bordetella pertussis, the main causative factor of whooping cough. And that's all I have for you today. Thanks, guys.
Okay, so we're going to talk about the signs and symptoms of pertussis. And it can be kind of divided out into 3 different stages. Stage 1 would be the catarrhal stage, and it'll last about 1 to 2 weeks. Stage 2 will be the paroxysmal stage, and it'll last about 1 to 6 weeks, but in extreme cases it can persist up to 10 weeks. And then stage 3 is going to be the convalescent stage, and that'll last about 2 to 3 weeks. So in total, this disease can last anywhere from 4 to 12 weeks, and that's a really long time. And you generally start presenting symptoms 4 to 7 days after exposure to the bacteria. So stage 1, the catarrhal stage, it is going to present pretty much the same way the common cold would present. So you're going to have a runny nose, and a lot of congestion, red, watery eyes, a low-grade fever, and a slight cough. And in infants, you often see apnea, which will just be pauses in breathing, so they're not breathing as regularly as they should be. And again, that will last 1 to 2 weeks. And then you'll enter stage 2, which is the paroxysmal stage. During this stage, you start to see the really characteristic symptoms of whooping cough, which is mainly just uncontrollable cough due to increased mucus in the airways. So in the catarrhal stage, you had a lot of mucus here, so a lot of nasal mucus and congestion, and as you move into the paroxysmal stage, it's going to kind of settle down into the upper respiratory tract and in the trachea and everything. So just producing lots and lots of mucus. And sometimes coughing becomes so severe that it can provoke vomiting. It'll cause the face to turn red or blue. It'll cause extreme fatigue, and oftentimes you hear a characteristic whooping breath between these coughs, and that's where pertussis gets its other name, which is whooping cough. And just an example of what whooping cough would sound like if we were listening to a toddler who had whooping cough, it would sound something like this. Yeah, so you can definitely hear that characteristic whooping inhale, just really struggling to get breath. And this would be what it would sound like in an adult. Yeah, so just really painful, really not fun. And I mean, we could keep this playing for an entire minute where they're just really struggling with this cough, with these coughing spells. So the coughing and the whooping sound are generally milder in teens and adults, but they can be very serious in infants, young children, and the elderly. Yeah, so just a very, very bad cough, and not fun. And again, that's going to last anywhere from 1 to 6 weeks. Stage 3 of pertussis is going to be the convalescent stage. So this will be the recovery period, and it lasts typically 2 to 3 weeks or more to get to a full recovery. And a lot of times you'll see people who they get better, but they try to get back to normal with their life, and then they kind of fall back into it, and they start having coughing spells again, and it can go on for months like that, just back and forth with being better and then being sick again and all of that. And also during this period, you're pretty susceptible to other respiratory infections, so that's not good either. Moving on to transmission of pertussis. Pertussis is actually, interestingly enough, only found in humans, and it's really contagious. It's spread through contact with mucus, so coughing and sneezing, and another person getting in contact with that. And I just thought it was interesting that infants will most often contract pertussis from siblings, parents, or caregivers who don't even know that they have the disease. So they'll get it from someone who doesn't even know that they're carrying it, which is a little bit scary. So that is the transmission of pertussis.
Hi. Okay, so I'm going to be going over some of the treatment and prevention and some other interesting facts about pertussis. So to start off, let's start with treatment. There are antibiotics out there that are used to treat pertussis. These include azithromycin, clarithromycin, erythromycin, and trimethoprim sulfamethoxazole. Bacteria are most likely absent after the first 3 weeks, so it's not typical that doctors will prescribe antibiotics after this period, although the symptoms may persist and the damage has already been done. When an infant is hospitalized, there are some common practices such as providing oxygen, clearing nasal passages, and keeping the infant hydrated, as these patients are at higher risk than normal adult patients. If the patient is being treated at home, it's important that they stay hydrated, that the room is kept free of irritants like smoke, dust, and chemical fumes, and that antibiotics are taken as directed. If vomiting is occurring because the coughing fits are so violent, it's also recommended that the patient is eating small, frequent meals throughout the day instead of big ones, because that will kind of help ease the nausea. So there's currently no cure for pertussis, so there's still work to be done. As far as prevention goes, there's a vaccine out there called DTaP. It stands for diphtheria, tetanus, and pertussis. It treats all three. It doesn't treat. It prevents all three of these. And although those who have had pertussis before can actually develop an immunity to it that will last from 4 to 20 years, but there's no way to know how long you'll be immune for it after you've had it. So it's still recommended that you get the vaccinations that are recommended. It's also advised that pregnant women receive this vaccine in the 3rd trimester of every single pregnancy that they have. Not only does it protect mom, but it also sends some antibodies onto the unborn infant. After the infant's born, the antibodies that it may have received will protect it for a short period of time, but then they are expected to receive that vaccine themselves at 2 months, and then 4, 6, 12, 15, and 18 months. And then they'll get it again at 4 years old and then 6 years old. There's some other interesting facts about pertussis. The most interesting thing to me is that there have been new strains of pertussis showing up. They lack this protein called pertactin, and the pertactin actually helps the bacteria cling to your airways and get you infected. So it's really important that that these new strains are being studied because we don't know if our vaccines are actually going to prevent these new strains or not. Pertussis actually is a pretty prevalent disease these days in the United States. Their numbers are increasing due to people not getting vaccinated. The coughing fits can last up to 10 weeks or more, and it's sometimes called the 100-day cough. Here's some more interesting facts. We're kind of out of time. I hope you guys enjoyed our presentation, and we look forward to learning about your presentations as well. Thank you.